Thank you. So cancer is like no other disease. It can creep out on you anytime, just like the star actor. Let me see in the next slide, please. Chadwick Boseman was only 43 when he died of colon cancer, and he's been battling it for 4 years. This could happen to any of us or even your family. So the real question is, why have we failed to prevent colon cancer? One simple reason. Many people just don't get tested early enough. And the reason for this is simple. Current screening test is invasive, it's unpleasant. Who wants to have such a test? So at GenieBiome, we offer a new solution. We are breaking the wall of colon cancer detection using novel bugs inside your gut. How do we start this story? Every single cancer develops from a polyp. It grows inside you slowly without you knowing. By the time it becomes a tomato-sized lesion, it starts to bleed. Current non-invasive test detects blood in the stool. By then, it's too late. So over a decade, our research team at the Chinese University of Hong Kong has identified the bacteria that cause colon cancer. And now, through these trillions of bacteria you can see here, today, we have managed to successfully hone down to the keystone bacteria species gene markers that can predict your risks of colon cancer. We call this M3. What do our data show? With this disruptive technology, with just 1 teaspoon of stool sample collected in the comfort of your home, we can predict your risk of cancer and polyps with high accuracy. Our data show M3 is as good as a gold standard colonoscopy, close to 100% sensitivity in detecting colon cancer. Not only that, M3 technology, compared to other non-invasive stool tests, you could see fails to detect polyps or early cancer. Now, M3 technology can bridge this unmet need in actually leading to higher accuracy for both early lesion detection. And all of this can be available to you in just 4 hours using our in-house machine learning algorithm. This is supported by robust science and 8 patents across 5 jurisdictions with freedom to operate. Unimaginable, the population that can actually benefit from this, as you can see here, is completely ginormous. But to us, this is not just a dream. We have actually launched M3 earlier this year in Hong Kong. To our key adopters are doctors, insurers, as well as healthcare clinics. We are now conducting clinical trials in mainland China with the aim of regulatory approval in a few years' time. The 2 key differentiators from GenieBiome is the disruptive technology driven by science. Secondly, over 20 years of research experience.
I think we can move on to the Q&A.
And you can see that these are our co-founders here. And we are raising Series B funding. And I think this technology is going to be applicable to the rest of the world as well. Thank you.
Hey, thank you for the speech. Can we just clarify, because there's already products in the marketplace like New Horizon, who is listed and already testing. And on the other hand, there's colonoscopy. So where are you, and what exactly is this technology? If you could clarify.
Absolutely. I just invited my co-founder, Francis, as well on stage. So you're absolutely right. I mean, I think currently with non-invasive stool tests, the M3 technology, there are 3 key differentiators. It detects the gene marker inside the bacteria, so which means that our human DNA cannot be edited. We cannot change it. And current stool tests, which you mentioned, and a few in America, detect the DNA of the human. But with the bacterial gene marker, we have a potential to completely change it to reduce your risk over time. This is the first differentiator. The second differentiator is that right now, most of these tests detect colorectal cancer. It's too late when it starts sort of bleeding. This test detects cancer even before it develops, which is the actual sort of polyp. So I think with that actually you can have early detection and you can also have prevention as well. So these are the 2 key differentiators.
Can you share some more stats? This is kind of interesting. Can you share some more stats in terms of like false positives, the size of polyps, these types of things that you're able to find?
Yes. So Currently, this is probably the only test that can detect the small polyps, because we know that polyps can be in different sizes. The larger the polyp, the higher the risk of colorectal cancer. Now we can detect up to less than 1 centimeter of actual polyp size. So when the polyp becomes 1 centimeter and above, we know that it may bleed. So the current stool test detects blood in the stool, but small polyps don't generally bleed. So you wouldn't know you actually have it. And with that sensitivity, we can reach up to above 70%. But these are only 4 gene markers. We are now expanding to several other gene markers. And we believe that over time, with the small polyps, it can go as close as even the colonoscopy, which is completely invasive. I think the second point to make is right now, after you have a polyp, it will be removed during colonoscopy, which means every single individual will need to repeat colonoscopy after every 1 or 2 years to monitor for that. M3 is the only world technology right now that can predict the recurrence of polyp. So I imagine one day you don't need a repeat colonoscopy. You just repeat a stool test at home every 6 months. And if that test is negative, we have a 90% sensitivity that you don't need a colonoscopy. It's completely safe to just monitor. So this will be the first non-invasive monitoring tool, apart from the screening aspect as well, which is different from any other competitor right now in the market.
I'll just sort of use your slide here as the visual aid, but you mentioned FTO and your multiple patents. Can you just sort of hone in on exactly why this creates enormous or semi-enormous barrier, your IP estate, and what the value of that is? And then I guess the second question is somewhat related. Your data and your algorithm that you alluded to earlier, tell us a little bit more about why that matters, how that works, and what sort of learning that's going to provide in terms of rapid escalation of accuracy, predictability, and so on.
Sure. So I'll take the first question, and Francis the second. I think the first question relates to the IP. So as we know currently, filing IP for something that's natural, which is a bacteria, is really not justified based on these American guidelines. So the IP that we protect is actually based on the very big reference data set, as well as the machine learning algorithm of the ratio of each of the bacteria that is present in a person. So give you, for instance, there are maybe 4 bacteria that can drive colon cancer, but each bacteria may drive it at a different rate. So if you have A too much of it, we know that that is a key marker that can basically be the main. So I think this protection, no one can copy it, because you won't have the reference data set of thousands and thousands of individuals to know what healthy is in order to know what cancer is. So that without that algorithm, you will not be able to reach that sort of sensitivity.
So why does what is FTO? How does that relate to an algorithm? You mentioned you had freedom to operate, but based on
yes,
I'm sorry,
that's
on
right.
what?
So at the moment, the license of the IP is exclusively licensed from the Chinese University of Hong Kong with 18 years of lifespan in order to operate this IP at the moment. And I think related to your second question, which is doing the clinical trials at the moment, in order to get into the regulatory approval stage, at the moment, we are conducting clinical trials in different sites around the world, because we have networks of hospitals in China and different areas of Asia, Singapore, Malaysia. So it's very important to make sure that this actually technology or innovation is also relevant to the rest of the Asian. At the moment, the bacteria in our gut really differs according to your ethnicity and where you come from, basically.
And do you have a chief medical officer?
Yes, we have a chief.
And who is that?
She's actually...
or just describe her background.
The background of the chief medical officer, she graduated from Medical University in China. And we chose her as a chief medical officer because she has got the kind of connection, the network with our our sister hospitals and our extensive hospital network in mainland China.
So your trial design, how does that look?
Yes, the trial.
Size of the design.
Oh, the clinical trials.
Yeah.
The clinical trials would be based on probably 5,000 subjects, because for a screening sort of population, we need to test the sensitivity for that. And sort of according to that, with the fecal occult blood test, which is the sort of stool test. So right now, this will be in the Greater Bay sort of region.
That's going to cost you a lot of money.
Yes.
Yeah,
so,
that's the reason why we want to do this Series B fundraising.
And you did a Series A when?
About 15 months ago, we completed.
And how much did you raise, if I may ask?
We raised $4 million.
And what are you intending to raise in the
10
Series
million
B?
US.
10.
Okay. Because getting regulatory approval is crucial for sort of an NMPA, but with what Mr. Leon has mentioned, I think it's now more positive now being able to get into the regulatory network to get the regulatory approval NMPA in China.
Has it been 18 months already since your Series A? I think our team talked to you guys in that round, right?
About yes, about
it's
probably
18
12,
months. Huh?
yeah,
that is
12, yeah, 1 year ago.
So maybe can you guys just give us some color on how the progress of the product has been in the Hong Kong market since you guys have launched? Like what are the key challenges in the go-to-market? What are the key challenges you're getting? The questions you're getting from the hospitals, or the doctors, or the people who are using it?
Yes, absolutely. So we launched that about 6 months ago, and the medical endorsement is very important to us because healthcare professional, ultimately this is cancer, this is a sort of condition. So we go B to sort of B at the moment. So it's launched in several private hospitals in Hong Kong right now, and also in several general sort of practitioner, because this is a primary screening test. So healthcare insurance and healthcare checkup would actually then incorporate this test. I think the key, challenges really is thinking about trying to increase compliance of screening. Right now in Hong Kong, only about 10 to 20% of people actually above the age of 45 we know should receive colorectal cancer screening, but 80% don't. So I think the challenge is the public education and the medical endorsement in order to tell the public that this is going to be partly customer driven as well as doctor driven.
I think we do have the kind of advantage in that we are clinicians and experts in the field, well known both locally and also internationally. So since we started launching this product some 6 months ago, it's been pretty well received in most of the private hospitals in Hong Kong. So our next step is really to, based on our brand name, to go into mainland China. But to get regulatory approval, first of all, we have already established the network of hospitals requiring to do this multi-center clinical trial in the mainland China with thousands of patients. And then, so these are our advantage, but trying to get the regulatory approval, that really takes time. So that's the reason why we need a COO who are from mainland China, who understand and try to work with the people in mainland China.
Judges, we have about 2 minutes left, so time for one more question.
Yeah, no, I just wanted to make a kind of a side note that, I think that this is obviously a very interesting technology. I think it's a very specific cancer screening test. There are a lot of other stool test providers out there. It's from a patient and a doctor perspective, or maybe more from a patient perspective, it's very difficult to tell the difference between maybe your bacterial markers and other colon cancer screening tests. And even there are a couple of like very big stool test provider companies out there, but I think it's taken them a very long time to get to any type of scale. For the ones that are from China, I think that they're maybe like 30 mil for 30 to 50 mil US in revenue after many years. And so I think like you guys will be facing a lot of challenges regarding the market size and educating the market for people to do it more. Do you see like a turning point to that? Like, do you feel like there is at some point down the line there is this is something that is going to be integrated into annual physical tests, or is there anything that you guys can do in that regard, like maybe working with insurance partners to make it mandatory or things like that?
To answer the question, I guess our main differentiator that no other companies can compete is that we can change our patient's fate. Other tests, you test the tumor DNA, you test the human genome, you can't change, but I tell your patient, now you've got this bad bacteria leading to your cancer, but by changing this bad bacteria, changing the gut environment, I can change your fate, your future risk of developing cancer. So this is really exciting. That's the reason why just within 6 months, we are well received by a lot of hospitals and also customers. So yes, there are competitors in mainland China. We estimated that we are able to kind of obtain something like 10% of the market size.
Just on that point,
Yes.
I mean, like in the 6 months, how many tests have you delivered?
Well, in 6 months, we have already delivered a few thousand. My CEO is not here, but if I remember, about 4,000 tests within 6 months, because it takes time to get into the hospital, and they're pretty well received.
Great.
I think
Thank
the
you very
game
much. I
changer-
think we're going to have to wrap up there, actually.
Yes, that
Thank you.
Thank you.